Okay, my patient name is TK. He is a 51-year-old Hispanic male who has been married for 15 years to his wife. They currently live in their home that they purchased when they got engaged 16 years ago. They currently have no children. So TK was TK was referred by his endocrinologist because he has a continued A1C of 9.1 despite having a rigid diet regimen and glucose checks. He TK is frustrated because with his wife because he's saying that she's not cooking the food right, and that's the reason why he can't get his A1C under control. And if he's not controlling it, and then he gets frustrated and he starts to panic, he needs to control everything per his wife. For his mental status exam, his grooming appearance was meticulous. His khakis, his shoes were shined. Yeah, his shoes were shined. His pants ironed. He had a nice collared shirt. Well groomed. His behavior definitely very controlling. His affect was a little constricted. His mood was frustrated. His speech very formal. His thought process definitely overly detailed. He had no thoughts of suicide or homicide. He just was kind of preoccupied with making sure everything was proper and there were no mistakes. He was a learner oriented times 4. He had an excellent memory of all the details. His judgment seemed fair in most cases, but there was no room for flexibility. Medical history includes being diagnosed with type 2 diabetes 10 years ago. He has hypertension that is well controlled and hypolipidemia. Both he takes medicines for. So he grew up in a household where his dad criticized him all the time. Nothing was ever good enough for his dad, whether it be school or work. He to make this better for him, he needed to have a strict regimen to feel comfortable. His marriage has become strained due to his controlling behaviors, like insisting on the type of meals and making sure they're made properly. Also, he does the same thing with tasks around the house, like making sure the cabinets are aligned and the chores around the house are done. Every Wednesday, that trash better be collected and outside by 6 o'clock. Every Wednesday, no excuses. But he feels like he's the one that has to have control and nobody else is doing it the way he wants to do it. And then he's mad at everybody because they're not aligned with how he's aligned. Family history: his father had coronary artery disease and his mother had type 2 diabetes and also depression. He is a non-smoker. He does drink alcohol occasionally. He does have 6 cups of coffee a day. He says he needs it to be productive. He does exercise daily. He has a strict regimen for exercise. So he does weight training 3 days a week. And then he goes for brisk walks 5 days a week. Again, we talked about his meal plans earlier. He definitely is regimented on his meal and nutrition. So he does not binge. Every now and then he has some sweets, when he's super stressed, but he sticks to his diet. And then he sleeps approximately 5 hours a night. And most of that is because his brain doesn't shut off because he's constantly thinking about what he has to do next, work, and making sure everything is always in order. So for him, the interview challenge is that Thomas can't stay focused on the goal. He wants to add irrelevant details and then becomes defensive when asked about how it makes him feel. He's insistent that he doesn't need therapy. He just needs people in his life who are more dependable and he can do what he needs to be done. So I think the type of therapy he would be best for him would be ACT. And in this therapy, the goals for him would be to help him recognize how his excessive behavior of controlling and perfectionism, its impact on others and its impact on him. And then how we can help him manage his diabetes in the process. And how this is also, his controlling behavior is also undermining his getting better and the relationships that he is forming. I think the specific things we would work on is acceptance. Learning to sit in discomfort would be one. And then him to be committed to an action, which means that he needs to be a little more flexible with the people around him. I think that would be great for TK.